Welcome to Dornsife Dialogues. We recently wrapped up the spring semester and welcomed a tremendously talented class of Dornsife graduates into our alumni community. I hope that some of our viewers today are among those 2021 graduates, and that you will continue to join us for events that engage our alumni, both on campus and virtually. Today, in the second part of our two-part series, in collaboration with the Keck School of Medicine on the transition to a post-COVID-19 world, we are here to talk about the lessons the pandemic has taught us about socioeconomic inequality. You might remember early on in the pandemic, hearing some political leaders refer to COVID-19 as an equalizer, saying things like, everyone is subject to this virus. I don't care how smart, how rich, or how powerful you think you are. In one sense, that's true. The virus itself doesn't see race, class, or identity. But it has also become abundantly clear that COVID-19 is anything but an equalizer. It has exposed huge disparities across American society, with low-income communities and people of color being disproportionately affected and dying at much higher rates. Our own Dornsife researchers found that minorities were receiving lower quality care in Southern California hospitals for COVID-19. It is also true that many of the most vulnerable members of our community, those who for health reasons should have been sheltering at home, were the ones most likely to be working on the front lines, or simply could not afford not to go to work. This is not the first time that health disparities have been exposed in this country. We have known full well that this is a serious problem. But maybe the past year has helped us wake up to the importance of doing a whole lot better. We have a terrific panel of experts with us here today who will tell us about how lessons from this past year can help inform a more equitable approach going forward. Arguably, the leading authority in California on this topic is our moderator, Manuel Pastor. Professor Pastor is a USC Distinguished Professor of Sociology and American Studies and Ethnicity, and is the Turpanjian Chair in Civil Society and Social Change. He also serves as the director of USC Dornsife's Equity Research Institute. Professor Pastor explores the economic, environmental, and social conditions facing low-income urban communities and the social movements seeking to change those realities. So without further ado, I will turn the program over to Professor Pastor's capable hands, and he will introduce our panelists today. Thank you again for joining us, and enjoy the program.
Thanks, Amber, for that introduction, and good to be with you all today as we consider the lessons of on inequality we've learned and continue to need to learn from the pandemic and COVID crisis that we've been part of. Let me start by, if we're going to talk about inequality, doing a land acknowledgement and recognizing that this event, even though it's actually probably on many different lands, because it's Zoom and you can zoom in from anywhere, that USC itself is on the land of the Tongva people of California. And we really want to acknowledge the ancestors, elders, and relations past, present, and forthcoming of the Tongva people, particularly because today there's been a very interesting report that was issued on American Indians and Alaskan Natives here in the state of California, and it's a much more sizable population than many people think. They think it's a past thing, it's also a present thing, and so it's important that we do this land acknowledgement. So excited about the conversation we're going to have today about what inequalities got revealed, exacerbated, and need to be addressed as a result of the COVID crisis. We have an all-star panel. I'm going to introduce them in just a second. If I truly introduce them, it would take about an hour because Howard's CV alone is, I think, 465 pages. I made the mistake of trying to print it, Howard. So let me introduce them very quickly and then try to frame this conversation. Howard, who is the chair of the Department of Preventive Medicine at Keck School here at the University of Southern California, the winner of numerous prizes, including the 2009 Linus Pauling Lifetime Achievement Award, 2011 Award of Excellence from the American Public Health Association. And in our pre-conversation, he's also the winner of the award for enduring the toughest weather because he lived for 7 years in Toronto. And the rest of us were complaining about our brief sojourns on the East Coast and our sort of warm embrace of the warmth that we have here in Southern California. We also have with us Sofia Gruskin, who heads USC's Institute of Inequalities in Global Health. She's also professor of preventive health and chief of the disease prevention policy and global health division at the Keck School of Medicine. Also the winner of numerous awards and the co-coordinator of the rights-oriented Research and Education Network for Sexual and Reproductive Health, which is a global network, and Sofia will be bringing to us both domestic and global perspectives. Also, she and I share that we're both graduates of the University of California at Santa Cruz, which means that we're now Trojans, but we were once banana slugs, or as I like to think of us, the fighting banana slugs, because there's nothing like a fierce banana slug working for justice, which is really what banana slugs are all about. And then we also have with us Kyla Thomas, who is now at the Dornsife Center for Economic and Social Research. She has sociology degrees from Princeton and also from UCLA. And the fact that we have allowed a UCLA person to be on this panel shows how severe this crisis is, that we've needed to build bridges to almost anyone to try to address the crisis. Most importantly, she's director of the LA Barometer, which is a quarterly survey that tracks social and economic conditions in Los Angeles County and has provided us a lot of sort of real-time data on what's going on with coronavirus reactions, both nationwide and with an oversample in Los Angeles. I know that's something you'll talk about. So let me just frame up this conversation by saying just a few things and then turning to our panel. The way I think about COVID, aside from sheer and abject fear and grief about what it's done to us, is to understand that this is a disease that revealed our illnesses as a society. It revealed the precarity of employment, how easy it was for people to lose their jobs. It revealed who is really an essential worker. Turns out it's not a highly paid manager of a hedge fund, but it's an agricultural worker, a meat packer, a grocery store worker, a healthcare worker. It revealed the racial wealth gaps because Black and Latino families, which in the United States have 1/10 of the net worth of white families, had much less of a cushion in this emergency. It revealed the problems with legal status, because if you were undocumented, and that's a significant share of our workforce and families here in California, you were unable to access so many of the resources that were available. So what COVID really revealed were all the pre-existing conditions of racial inequality, including being on the wrong side of the digital divide in the year of lost learning that's been most profound for Black and Latino kids, particularly low-income communities. The COVID crisis has also starkly revealed the difference between equality and equity. This perhaps most clear in the rollout of the vaccines. The rollout of the vaccines was super equal. If you were of a particular age group and occupational category, everybody had the same shot at getting a shot as long as they had a computer, access to high-speed internet, the technological sophistication to put an automatic refresher on their browser so that they could keep refreshing the pages looking for appointments. The kind of job like mine, where you can take a couple of hours off in the middle of the afternoon once an appointment opens up and no one is docking your pay, and a private vehicle to be able to get to the pods that were available early on for shots. Completely equal, completely inequitable, because if you were on the wrong side of the digital divide, if you were on the wrong side of employment quality, if you were on the wrong side of transit independence, you didn't really have a shot at getting a shot. So COVID, the illness that revealed a disease that revealed an illness of society, it's illustrated the difference between equity and equality. And it's also called on us to try to, I think, challenge inequality and anticipate the future. I know that when the disease first broke out a year from now, aside from trying to talk my son, who's a musician, out of heading into New York to do just one more crisis, one more concert, that I started writing immediately about how immigrants were going to get really nailed by this disease, both on the disease side and on the economic side, anticipating what was about to happen. And so part of the conversation we want to have today is looking forward 5 or 6 months from now, what is it that we need to address? So again, an all-star panel, and I want to open it up by turning to Howard and asking kind of a broad question about, as COVID broke out, what did you begin to study and what have you learned from this crisis? I know that I got called to do a particular kind of work I can talk about a little bit later on, but what did you get called on to do? What have you learned in the year that's taken place?
Great question. Before I start, I just want to acknowledge that I didn't know, Manuel, that in addition to your other titles, you are the professor of wit and exaggeration. So thank you for that introduction earlier on today. As a physician and an epidemiologist, our faculty pivoted right away to try to understand what were the population health costs. This is what we do. We deal with numbers. And it immediately became clear that not only was COVID having a heavy toll in terms of morbidity and mortality, but that there were disparities. And here in California, the statistics pretty early showed that Latinos and Blacks in particular were dying at far higher rates than whites. And it also corresponded with geographic disparities throughout the city. And, you know, when we see disparities like that, we immediately go to our playbook in understanding the why. We try to understand whether it has to do with differential exposures, differential susceptibility to when you get the exposures of having, of getting infected. Once you get infected, differential severity of the infection towards worse outcomes. And then once you have worse outcomes, what is your access to care and what's the quality of that care? And we bring that to the inquiries, because that's been the experience in understanding disparities in the past. And each one of those can then be segmented into other disparities relating to the types of occupations. Just like you said, you know, essential workers, we know who those are now. They're not the hedge fund managers, but they're the people who have to go to work to try to deal with this crisis and keep people going and businesses going. But those same people live in housing that's much more crowded, has poor ventilation. Those same people have comorbidities, more likely to have diabetes, hypertension, obesity. They're more likely to be in polluted environments. And now we know pollution exacerbates the inflammatory reaction to infection. So all the way down the line, we could totally align with the whole rubric of this was the disease that was going to reveal the illness, as you mentioned, all these different disparities all the way down the line. That's what we keep finding, uncovering, and trying to document as this epidemic unfolded.
You know, Howard, I had a conversation early on because we did a project called No Going Back, which was looking at the impacts of COVID in Los Angeles. And initially we were thinking about what would be the roadmap to recovery. And then we realized, why would you want to go back to a normal that really didn't work for a lot of people, left so many people vulnerable? But in the midst of presenting some of the data, I was presenting the disparities on Black deaths relative to white deaths. And one person said, well, isn't that, you know, not really racism? It's just a function of the comorbidities like the diabetes, obesity, and hypertension. And I said, well, all of those are actually a function of structural racism. Food deserts, places where there aren't enough parks to play, and simply the stress of being Black in America, which contributes to hypertension. How do you struggle with that or make that point to audiences that these, as much as we want to find the different channels that actually that help us trace and close the gaps, that really these are fundamentally about structural inequality?
Yeah. Well, it's by doing exactly what you said, which is trying to reveal the larger realities. In epidemiology, we construct um, these conceptual diagrams called direct acyclic graphs. And they're basically the causality pathways that we're revealing more and more as we get better tools to understand how to research what are the causes of hypertension, diabetes, obesity. Uh, and so much that has been revealed is that it's really not genetics. This is what medicine was obsessed with 20 years ago, especially when we finished sequencing the human genome. Is that, oh yeah, now we're going to figure out all the genetic causes of the diseases. The more we uncovered, the more we realized that we're much more genetically similar across the race and ethnicities than we had previously thought. And now we also understand that so much of these disparities are actually related to underlying social reasons, occupational reasons, environmental reasons, and that contributes to this whole discussion of, well, if you want to fix it, you got to deal with these underlying problems.
That really, I think, kind of turns us to Kyla, if Kyla wouldn't mind speaking next, because that's a lot of what you learned through the work that you and Caesar did to try to respond to the pandemic. Can you talk a little bit about the survey that y'all rolled out, what you were learning, and what it revealed to you as a sociologist?
Yeah, so the Center for Economic and Social Research, or CSER, we run a national panel of about 9,000 US residents. We've been surveying them for years now on a monthly basis. And the nice thing about this panel is that when COVID hit in mid-March, we were really well positioned to try to understand the effect it was having nationally. And then also specifically in LA, we have an oversample of about 1,800 LA County residents. And so it was a lot of work. We all had to, very quickly put together this bi-weekly survey. It's now monthly, and we've been tracking kind of the the impact on people's behaviors, their economic outcomes, their mental health. Also, every relevant outcome we've been tracking since the start of the pandemic, both nationally and in LA. I really appreciate this opportunity to reflect on what we found, because I've been so in the weeds of data collection and analysis and just trying to provide data that's useful in real time, that it's nice to kind of step back and see the bigger picture. And I think, in looking at all of the data we've collected, I think two things kind of really stood out to me. One, I think the pandemic revealed just how precarious our social order is, how vulnerable we are in our social standing. So for example, women, they've made inroads when it comes to educational attainment. They make up more than 50% of the workforce, but in the face of the pandemic, they lost jobs at higher rates. They were more likely than men to reduce work hours. And then, in families, we saw that the burden of childcare, due to school closures, fell disproportionately on women. I think the pandemic also revealed the vulnerable position that Asian Americans occupy in our society. How quickly people started to target Asian Americans as more likely to infect others, as kind of the source of this contagion, is really telling. And then the second thing that really stood out to me in looking at the impact of the pandemic was the role that schools and workplaces play in our society. So as a sociologist, I study inequality, and one of my specific areas of focus is discrimination. So I'm very interested in understanding the ways in which schools, labor markets, workplaces serve as institutions in which inequalities are reproduced. So, they reward certain groups over others, the way we think about merit, and it tends to kind of favor certain groups over others. That's my lens. But what the pandemic revealed to me is also the role these institutions play in mitigating the effects of inequality, or at least papering over the cracks. So, when you shut down schools, for example, we then have to grapple with kind of the full extent of food insecurity.
Yeah.
Children going hungry. When you shut down schools, cases of child abuse go unreported because teachers aren't there to see it, and working mothers have to grapple with the gender inequality that still exists in our society. These aren't necessarily, when you strip these institutions away, you also see that they're relieving some of the symptoms of inequality in our society, but they aren't necessarily fixing the problem.
Yeah, well, God, I totally relate to that. My wife is the superintendent of a school district, and so she had in the first couple of weeks to do a combination of getting it's a district that's about 85% on free and reduced price lunch, about 90% Latino and Black, and they had to get them Chromebooks and hotspots, and then set up food.
Right.
Because it was the single source of people. And you forget how much these institutions are taking the ravages of inequality and sort of putting them out of sight
Right.
from us in a way that also happened with the explosion of the homeless population and the housing insecurity that resulted. So yeah, deep. Sofia, I want to ask you what you kind of like to studying and what you've learned, and maybe hopefully you'll bring us a little bit global, because we've stuck very much in the Los Angeles and Southern California and California weeds a little bit. One thing I did want to add to something Howard said is that another population super hard hit in Southern California was Pacific Islanders, where the case rates and death rates were about 5 times what they were for whites. And that sample size is big enough that that's probably reliable. And it also had to do with overcrowded housing, family patterns, and the kind of work that people ran. But it's important to mention that community too. So Sofia, what did you learn? What did you study? Better take off your mute.
That would be helpful, wouldn't it? Yeah. Okay. Yeah. Just a couple of things just to say up front, which is that, I think it's not only about showing us the fault lines within our societies, across our societies, but also what commitment there is or lack of commitment to do anything about it. And I just want to be clear kind of what I mean by that. Most of us are living or have lived with like this shelter at home directive idea, but this is happening in real time for people around the world. And I just want to be clear, it's not like it's just for a couple of weeks. It can be for months at a time. And when people are poor, and I'm going to use that I work in closely, if you're thinking about places like India or Brazil, and you're thinking about poor communities in those countries, or you're thinking about countries where not even one person has yet to receive a vaccine, not even healthcare workers, countries like Chad or Burkina Faso or Burundi, and they may not until 2023. So just to be clear, what does a shelter at home directive mean if you can't stock up on food because you don't have the money to do so, if you live with an abusive partner in the ways that Kyla was talking about, or you have to get to a pharmacy to get your medications because they're not available in large enough prescriptions, but you need them in order to live. What are you supposed to do then? And I don't know if any of you saw this, but on Friday, a 17-year-old boy died in Uttar Pradesh in India because he was beaten to death by the police because he was violating coronavirus curfew. And the reason he was violating the curfew was because he was selling vegetables in front of his house. And I just think this really gets you thinking in practice, like, what does it mean for like 1.3 billion people in India, but just in general to be mandated not to leave your house for any reason. And the issue for me is about the regulations in all countries of the world that are being put in place in the name of COVID. Who's implementing them? The part of government that's responsible. It's not the health department, it's the police. It's the military often that are doing this. And, you know, I want to start by saying that on this, that governments, I think, are trying to do the right thing in an impossible situation. But the issue is how these things are playing out in practice. I mean, around the globe, we know in terms of our data, there are hundreds of thousands of people, no exaggeration, who have been detained for non-compliance with COVID-related orders. And we've got data that our colleagues have been collecting to show that this is similar to what's happened to this young man. Like thousands of people have been beaten by the police and arrested for not complying with COVID orders, but then they're immediately let go after being beaten up because the police didn't have the facilities to hold them. And you have to ask, is this good for public health? I mean, these regulations are being put into place in the name of public health. And I can't stress enough that everywhere in the world, those who are most impacted by COVID, whether it's in excess, inequities in access to testing or to PPE or to vaccine, or to the ways in which these laws are enforced, they're always the people who are most marginalized or discriminated against. And, just two kind of data points in terms of some of our studies, in August of last year, so, quite a while ago now, we saw that 69% of Kenyans reported reduced earnings and 43% reported a complete loss of income. Can you imagine like what that means right now? Then you're thinking about the risk of food insecurity, of hunger, malnutrition, all those things that y'all were just talking about. And then in Brazil, we've been analyzing the effects of COVID on the sexual and mental health of transgender women and men who have sex with men. And what we found is this need to have to hide pre-exposure prophylaxis or the fact that you're taking antiretroviral drugs because you're living with family members, right? Means you can't leave your home to take your drugs. So what's going to happen? You're going to discontinue use. And so the longer term effects on health and well-being, let alone, I mean, you all were talking about schools and kind of the issue with schools, in places where there's been no online education, basically education has been put on hold for a year at a time. What that means for societies as a whole is something that I think we need to get our heads around. I mean, the pandemic isn't over till it's over for everyone. And I don't think it's going to be over for a very long time. And I guess I'll stop there.
Wow. Let's say that was not a mood picker-upper. It's a somber awareness of what's coming. And that's kind of what I wanted to move to. I've been thinking a lot about this. When COVID first broke in the United States, I was like, oh my God, it's immigrants in particular are going to get nailed by this, both because of the overcrowded housing, the kind of work, and the lack of access to government assistance. When people in California were worried about what was going to happen to the state budget, I was like, I don't think it's going to be that bad because what's gone on is tremendous inequality. The stock market's shot up, real estate prices have risen. Anybody making more than $150,000 a year still making the same amount of money. And it's really people making less than 40 who just got jammed by this recession. It's a very different recession. It's a she-recession, as Kyla was mentioning. It's affecting women more than men, but it's also meant the wealthy are doing quite well because we've got a progressive tax structure. Money's coming into the state, which is why we've got a $75 billion surplus just on the state side, even before we get any federal relief. Having had the experience of anticipating some things that happened, I'm starting to think about what happens as we emerge in California. And what is the level of mental health trauma that's going to be there? What is the level of public health dysfunction? What is the level of economic damage that's going to be there? And I'll start with Howard. As you start to anticipate what the next 3 to 6 months to year looks like, what are you worried about? And what do you think we should be preparing for?
Great question. I will say just a few weeks ago, I was on a conference call with Michelle Walensky, the new director of the CDC, and she started off by saying, Don't anybody ask me to predict what's going to happen in 2 to 3 months. I have no idea, because it depends so much on variables that we don't understand about behavior, about the variants, about politics, and it goes on and on. But what is very clear is that the infrastructure for understanding how to monitor and survey the evolution of this pandemic and future pandemics needs to be strengthened and be prepared for what's going to come down the pike. What's also clear is that we're not really in the middle of just one pandemic. There are other major population, global health-wide things are happening. The other one, obviously, is climate change. And climate change and the pandemic intersect in ways that will further exacerbate disparities, which is incredible, but true. When you think about populations that will need to migrate because of climate change in the middle of an ongoing pandemic, is just mind-boggling. So clearly, infrastructure is something that we have underinvested in this country and globally for a long time. I'm talking about infrastructure for population health. That needs to be strengthened for sure. And then understanding all of these underlying causes, reasons, things that exacerbate these disparities can be picked away at component by component, because there is no way of just simply wiping them away or dealing with one and hoping that it'll deal with the others. All of them deserve attention.
So sorry for making you try to predict the future. The advantage for both you and me is that if Rochelle Walensky predicts the future, people will listen to her. But if you and I predict the future, no one cares really anyway, so we can at least speculate. But I think what you've lifted up is the need for us to stand up a better public health infrastructure to deal with pandemics that might come, and to recognize the reality of climate change as well, and what that's going to do in terms of migrations, public health risks, et cetera. Kyla, let me turn to you as you start to think about the future and taking on this, risky thing of predicting what we should be worried about. But what are you worried about? What do you think we should be worried about?
Yeah, I mean, one of the things I'm worried about is all of the gaps in our social safety net. So we recently kind of looked at all of the data we've collected since last March, and we tried to kind of quantify the impact of the pandemic in all on all sorts of aspects of life. And we looked at rates of who experienced financial insecurity at some point, who experienced symptoms of moderate to severe psychological distress, who experienced COVID-based discrimination or missed a housing payment. And we found that when we added all of these experiences of hardship up through this March, the end of this March, 80% of US adults in our sample had experienced some form of serious hardship. And that, that's very striking. Perhaps not surprising when if you've been tracking this the whole time, but that's a large number, and our government agencies have not been equipped, financially in terms of, numbers of staff to handle this level of need. I mean, financial hardship was the most commonly reported one, along with symptoms of stress and psychological distress. So, that's one thing I'm worried about. Another thing I'm worried about is another thing that was really striking to me when we kind of reviewed all of these experiences of hardship is in every survey we asked people if they knew somebody who had died from COVID. And when we looked at racial and ethnic differences in the percent of people who knew somebody who died from COVID, about 30% of Black and Hispanic respondents reported that they knew somebody. And that was about twice the rate that we saw among non-Hispanic white residents. And so when you think about the, what are the ripple effects of that? So, there's, loss of life itself is a problem, but we are, we live in an interdependent, society, and when loss of life is also loss of a breadwinner or a caregiver. Think about the all of the ways in which we depend on one another. And so when certain communities are experiencing a disproportionate loss of life, what impact does that have on their future outcomes on what is kind of the economic and social impact of that loss of life?
One direct impact of that, again, looping back to my wife, who I learn everything from, and Sofia knows, so she can report that I'm boasting about her, is that her district, while under a lot of pressure to open back up, hasn't seen a lot of kids come back. And while an adjoining district, which is white and wealthy, has seen like 80 to 90% of the kids come back. And the reason is that her constituency, low income, overwhelmingly Latino and Black, has been so scarred by this in terms of death and in terms of illness, that the fear of contracting the disease by putting your children in a congregate setting and then having them come back home is just devastating and fearful. And that means too, then those talk about economic impacts, the impact on losing even more in-person learning because of a well-placed fear of the way that you might have felt because of the loss. And also the psychological loss of feeling like you were abandoned by your government. That when we saw these disparities by race, that it took the longest time for states and the nation to really even seriously address it. For example, California did with a health equity metric, finally, in the summer of last year. But, that's also a psychological sense of like, the government really doesn't care about me. Sofia, when you think about the future and what you think we should be worrying about, anticipating, what comes to your mind? Then I can have one last round of questions for us.
My biggest thing is I think that the inequities that exist between countries are going to be that we're going to end up as being two different worlds, right? And I really think we have to deal with this. I mean, if you think about it, we are in our way creeping back to normal, right? We're worrying about access to unused vaccine. We're starting to have those sorts of conversations. And just to kind of put that in context, in the past 2 weeks, globally, more cases have been reported than in the first 6 months of the pandemic. I mean, health systems are collapsing everywhere. Again, most people in the world are not going to have access to vaccines till 2023. That kind of inequality and what it means about how we deal with one another as countries and as global citizens is hugely worrying. But let me just get into some other issues that there's a lot of people that exploit people's fears and take advantage of what's happening. And that has huge implications for public health. I mean, there is this rise in fake vaccination cards that's happening. And I mean, we've been hearing about it kind of locally, but if they're key, not just to restaurants and, kind of global travel, but basically it's not the random cases that we're seeing now. I mean, this is going to be huge in terms of people who are basically getting fake vaccination cards in order to be able to function in society. And I'm not talking about the anti-vaxxers. I'm really talking about people who aren't able to access the vaccines. There's also, again, in a number of countries, these counterfeit fake vaccines that are being sold on the black market, right? And you think about what that means in terms of people's individual health, but at a public health perspective. So I worry about that. And just what else I worry about, one of the things that I think isn't getting enough attention is the extent to which governments were given huge latitude to pass emergency laws without normal review because COVID is an emergency, but also without necessarily proper evidence or review or accountability. And I'll give you an example in terms of surveillance, contact tracing, using phone apps. I mean, that's been part of and vital to controlling COVID in so many ways, but these data are being collected and it's not clear where it's going and what it's going to mean for monitoring people's movements and contacts over and above the specifics of COVID. Yeah, in the US, probably the apps will be taken off, but there's a number of governments that are now arguing that the purpose of the app should change. And it should be used to be able to track people's personal health status, their personal contacts and lifestyle choices in the name of public health once the virus isn't a threat. And I think we really have to think about who's going to access information, who decides that governments can make this choice. And I'm really worried about this kind of misuse of the ways in which law is coming into place. And then one of the other things in terms of not so much a worry, but a hope maybe that I, in terms of just kind of being able to think about what this looks like, which is that I think that one of the things that's been really important is that COVID helped people in this country, some people in this country who are on the fence around Trump, to really see the harms that Trump caused. And I see this happening with authoritarian rulers in other places. I don't think it's an accident that both Modi and Bolsonaro have their worst approval ratings ever right now during COVID. And so I feel like that's sort of like a light into the future in terms of potentially there's something that we can move towards.
Great. Well, as usual, my good friend Sofia brought the gloomiest perspective into the conversation. Thank you for that. But let me, that's a really perfect segue to the next thing, which is maybe a little bit quicker from each of us. How do you make change? How do you take these big, challenging structural issues and kind of create the possibility of change? I know, at least initially, I was hopeful that what COVID would be a wake-up call around our need for mutuality and solidarity, knowing that the only way we protect our selves is if we protect other people, and that we wear a mask to protect ourselves, but also to protect other people, that we are only as weak, as strong as the weakest chain in terms of public health, recognizing who are the essential workers, et cetera. But it also seems like a lot of those lessons get easily forgotten. So Howard, simple question. You've been researching the structural determinants of health. How do you change those structural determinants?
Well, before I answer that, I just need to put in one additional somewhat gloomy fact, which is that part of what we're studying is what we now understand as disinformation epidemiology, which is part of what's made this pandemic so much worse, is the spread of disinformation that just makes people do the wrong thing, believe the wrong thing. And unfortunately, that has cost, not only in terms of the human toll of the epidemic, but in terms of the political will of the people to make those kinds of changes that are really necessary to improve our ability to respond to the next epidemic or even this one. So I think part of the answer is science, but also figuring out how to communicate that science better. We actually have some scientists in our department led by Tom Valenti who I'm sure you know well, works on networks. That is the science of understanding the spread of information and the communities, and understanding where there might be sensitive points in being able to staunch the flow of disinformation and improve that. That's definitely going to be one of the steps, I think, to actually improving the soil for how you can start proposing changes that will ultimately improve the infrastructure and address some of these structural determinants.
Wow, the ability to recognize facts and reality. You're making a social scientist swoon. Let me turn to Sofia, because Sofia, you actually kind of closed by talking about the political possibilities in terms of the discrediting of Trump through the pandemic, the discrediting of Bolsonaro and Modi as a result of their mismanagement of the pandemic. That sounded like that gave you a little bit of hope. How do we make change? There's a question that came in from someone, haven't we always lived in two worlds? So is there something about this moment that makes it possible to make change and link those worlds? How do you make change?
Yeah, I mean, I sure hope so. I mean, let's be clear. I think I felt like my whole life, it's always like 2 steps forward, 1 step back, right? And when we think about what does it take to make lasting change, I mean, I think one thing that is I do want to say is I think I have a lot of hope for the younger generation. I think just like who was defining for my generation, I think COVID is for younger folks. And I think that has to do not just with making change around, oh, public health is important and what to do about it, but actually what it means to kind of address the need to address structural inequalities. And I see for the first time, I think, kind of just this kind of a move towards trying to pay attention and to global solidarity. We have to make sure that that isn't lost. I think we have to make sure that we remain outraged by what COVID has exposed. But I'm a lawyer, right? And I just want to say kind of 2 things that I have positive feelings about in terms of being able to think about things. I think that there's this idea of this international pandemic treaty. And I don't know if you saw, but the Biden administration today delayed even the ability to have this even discussed as something that was going to be able to move forward. But I consider that as a key to being able to address power imbalances between states in terms of a major public health crisis. I think it's crazy that it's being delayed to even be able to think about doing this work, given how long negotiations take. So I think that focus on internationally shoring up kind of a legal foundation, I think it's important for us very much in terms of what you were saying to figure out what do we mean by a just recovery? How are we going to move that forward? And I think that that's going to be key in terms of thinking about politics, about systems, and really the impacts on people's lives and how it is that people can organize around those issues and listening to each other.
Kyla, what are your thoughts? How do we make change? I know when we were conversing about, you said it's easier for tenured professors to mouth off about making change than untenured professors, but act like you're tenured. It'll be fun.
Great. I mean, I think we need to, I think what the pandemic has shown us is that economic inequality is a massive social problem. It's a public health problem. It's bad for business. And so I think where we really need to start is with more equitable social and economic policies. I mean, we need to raise people up from the bottom, and we need to address the gaps in our safety net that are making these inequalities worse. When we live in a world as interdependent as the one we live in, inequality is a really big problem. You talked about solidarity and being hopeful that we would see the value of solidarity. Well, what research has shown is that high levels of economic inequality erode social trust. And when you live in a society where adherence to public health guidelines like sheltering in place is actually a privilege, where some people don't have the privilege, the economic privilege to actually participate in that kind of adherence, it becomes really, it just makes us less resilient to any kind of crisis. I think it's a big ask, especially, in a place like the US, but I think it's really should be the starting point. Another kind of lesson that I've taken from the research that I've done, and something that I think would be really important, in future crises is having more funding for research and data collection at the local level. So when COVID hit the US, the LA Department of Public Health reached out to us, and they really wanted our help in collecting data to better understand, what was going on in LA. And the challenge was funding. I think that city and county policymakers could really benefit from more data, but an empirically kind of grounded understanding of what's going on in their community to inform their decisions. But there's just not a lot of room in their budgets for that. So there's a lot of need in kind of communities for kind of ongoing research. But one thing I've discovered in working with city and county policymakers is there's not a lot of support for it.
Such an important point to lift up. I want to ask Howard one question, then I'm going to do a final go around with everyone. And then we're going to do something that is remarkable for a Zoom conversation. We are going to end early because we realize that if we end early and you actually have a chance to go to the bathroom between now and your 1 o'clock Zoom, that you will remember us with great gratitude and warm feelings, and perhaps send checks to Dornsife in particular to fund the research that Kyla is talking about. But Howard, what innovative community care programs do you think may have emerged in the COVID crisis? I was kind of impressed by the reliance on community clinics, the ways that the community clinics started to say, well, we need to make sure it's people from the same zip code, the mobile clinics. There was a lot to beginning to use more local health promoters. I know that's an old thing, but in ways it's really important. What kind of program lessons have we learned that public health people should know about going forward?
Yeah, that's a great question. Well, the whole epidemic, for one thing, taught us the value of contact tracing, done properly, of course, with proper attention to human rights. Contact tracing is all about getting into the community and gaining the trust of the community to understand the evolution of the pandemic. Community-based programs have, for the most part, been neglected from a health perspective here in the U.S. The entire healthcare system has remained health-centric in terms of hospitals and clinics, whereas we have generations of research showing that even in high-income countries, being able to visit people in their homes and understanding the ground reality, let alone providing more access to people on access to information and how they're doing, is so much better for improving community health. I think there are some interesting middle ground points. Actually, one of the things that has been positive about the pandemic is that it's accelerated the movement toward telemedicine. And even though that does depend on an internet connection, et cetera, it's also accelerated some of the access of people to the internet on some levels, certainly not in folks in the lowest socioeconomic status level, but we could anticipate a future where more people will have access and there'll be a greater access in general to people, to health advice, health evaluations, et cetera, for people who need it, including people who are in dire need. So that, I think, is part of what we might anticipate in the future. But I think that we've also been taught the value of community-based programs as part of what we're learning in this pandemic.
That's great. So one last thing, and if each of you could do 30 to 45 seconds, sort of a last thought you want to make sure you leave with the audience that's listening in, a big lesson or a big learning or a big concern, just a last thought for 30 or 45 seconds. And I'll start with Sofia.
Okay, I think I would start with the fact that we have to acknowledge our place of privilege in terms of our ability to even have this sort of conversation and the space that we're in and what does it mean to take that responsibility. And I recognize that particularly in somebody who's concerned about global health that's sitting in a US-based institution, right? And I understand the colonialist tendencies and the whole piece, but I think we have to really be able to work with each other and hear each other. I have a lot more to say, but I'm gonna shut up. So go for it.
Thank you. That was remarkably succinct and on point. Kyla, last thought.
I think I would just want to reiterate what I just said, which is that inequality hurts all of us. It doesn't just hurt the people at the bottom, and that I really think trying to address economic and social inequality should really be our starting point in trying to improve our resilience as a society.
Howard, last thought you want to leave people with?
Yeah, somewhat different thought. You know, so many of the people on this call may have relatives or thinking themselves of training in health. I think one of the brighter spots of this pandemic is that it has taught a lot of our colleagues in medical education that we can no longer ignore social determinants of health. And all of you, no matter whether you're going to train in treating individual patients or going to population health, will have a much firmer understanding, I hope, in the future of what really determines health and how we can preserve people in being healthy.
Thanks. And I'll take a minute or two to tell a story as a way of closing that just came to mind during this conversation about another moment of deep trauma and stress for at least Southern California, which was the 1992 civil unrest prompted by the reaction to the verdict in the trial of 4 police officers who had beaten Rodney King. Somehow appropriate to remember this day after the anniversary of the murder of George Floyd. And for those of you who were living in Los Angeles at the time, you'll remember that the city blew up, that the city was actually capped by smoke from all the fires and arson and violence, and the rage that was there about a very unfair system. And a couple days after the things had kind of cooled down, I was driving my son, who was 5 years old at the time, from where we lived in Northeast Los Angeles to Whittier, where my parents lived. And as we were going through downtown, my son, who was 5 years old, turned to me and said, "Daddy, is the war of the fires over?" Because for him, as a kid, what it was a war of fires. And what I said to him then was, his name is Joaquin, this time Joaquin, this time. And that helped propel me on a path of researching and working on income inequality and racial inequality in Los Angeles, those underlying causes that had triggered the unrest and then made the recovery so much more difficult for the communities that were scarred by the violence. And I committed my life to that. It's kind of what I still do now, heading something called the Equity Research Institute here at USC. And I'm hoping that for the audience and for all of us, that COVID is a wake-up call, that it's illustrated these issues of inequality, and that it will call on us as researchers to commit to providing the real information, as Howard was talking about, to having a global perspective, as Sofia was talking about, to driving local community-based projects that make data very available, as Kyla was talking about, so that we can be of maximum use as we address not just the pandemic, but the deep disease of inequality, racial and economic, that has long infected both this nation and the world. We thank you for being part of the Dornsife Dialogues today. We sign out a couple of minutes early so that you will remember us as the people that closed on time. Thank you.